कॉन्फ्रेंस का थीम मेंटल हेल्थ इन द रूरल एरियाज, चैलेंजेस एंड द अपॉर्चुनिटी। बहुत बातें होती हैं, बहुत बातें सुनी जाती हैं। तो एक प्रोजेक्ट हम पिछले 6 साल से रन कर रहे हैं, विच इज़ गोइंग टू चैलेंज द ओल्ड। लेट्स सी हाउ वी कैन क्रिएट द होप। आजकल के ज़माने में जहाँ सब कुछ मुश्किल में है, सो कैन वी प्रोवाइड सम होप। व्हेन वी टॉक अबाउट द रूरल एरियाज, वो लोग रूरल एरियाज की बात करते हैं जिन्होंने कभी रूरल एरिया देखा ही नहीं है। आई विश कि वो पंजाब के, सिंध के रूरल एरियाज में जाएं और देखें कि रूरल एरियाज क्या हैं, लोगों के मसाइल क्या हैं। और लेट मी बी वेरी क्लियर about the conflict of the interest. There is no conflict of interest except khairun nas man yanfun nas. तुम में से बेहतर वो शख्स है जो लोगों को नफ़ा पहुंचाए, लोगों को फ़ायदा पहुंचाए। Now, I would just like that you should refresh a few definitions, just a few definitions. What is health? And health is a state of complete physical, mental and social well-being, and not just merely the absence of disease or infirmity. Now, what is the level of worldwide access to the health? More than half of the world's population does not have access to the health care, and healthcare access improvements are uneven, focusing on the urban and the high income groups. And low and middle income countries have worse healthcare access and outcomes. And 60%, less than 60% population in these countries has no access to the healthcare. And there is a large burden of diseases. Nearly 15% of the years of life are lost due to the mental disorders. And in lower and middle income countries, less than 80% population has no access to the appropriate mental health care. This is the WHO study 222. And in Pakistan, there are about more or less 500 psychiatrists who practice in a population of more than 230 million people. What about Pakistan? And in Pakistan, access to the health and health-related indicators is a major concern. Health inequality is more in the hard-to-reach areas. And 40% of the Pakistani population lives in multidimensional poverty, and less than 20% of population has access to the public health care. 2020, Pakistan spent just 1.2% of its GDP on healthcare and lags behind the neighboring nations. What is the current model of healthcare? What is the current model of the healthcare? The symptoms appear, the patient travels, goes to the doctor, receives the treatment, and he returns home. This is the current model of the healthcare which we practice. Now, what are the deficiencies in this healthcare model? There is a delay of the diagnosis, there is a delay or lack of the follow-up, and there is lack of access to the proper medication. What should be our goal? Our goal is to make healthcare more accessible. And how we can do this? The roadblocks to provide this healthcare access are, the number one is the distance. Most tertiary care hospitals are hundreds of kilometers away. And secondary care hospitals, even if closer, they lack the specialists. Number two, the cost. The direct cost of healthcare are major roadblocks, and indirect costs in the form of travel expenses and the medication expenses are increasing day by day. Primary and secondary care facilities lack trained staff for many specialties. And laboratory and diagnostic equipment are expensive and often unavailable. And ladies and gentlemen, if you unfortunately fall ill in the hard-to-reach areas, we are doing a clinic in the Bakhar, and we have just roughly calculated the costs. If a psychiatric patient comes to you, usually there are 4 people accompanying that patient. Or if a child comes to you, father, mother, and usually the siblings, they are all who travel with them. And if you see the cost, if they have to go to Lahore, Multan, and if they are an average of the 4 people's travel cost, boarding and lodging, अगर वो भक्कर से चलेगा, रात को मुल्तान आके रहेगा, होटल में रहेगा, अपनी दिहाड़ी पे नहीं जाएगा, काम नहीं करेगा, कंसल्टेंट की फीस सिर्फ 2000 है, लेकिन एक दिन में you can very well see 15 to 20,000 he has to pay. और इसमें मैंने अभी ये शामिल नहीं की the cost of the prescription. In the last 6 months, I believe more than 3 times the prices have gone up of essential psychiatric medications. और अगर आप इस सारी prescription को भी add कर लें, तो it goes more or less 20,000 or 20,000 plus. What are the methods? How we can create the intervention? What are the guidelines? So, ladies and gentlemen, if we leave behind the previous medical problem, we have created what we call top-down, bottom-up, reaching the unreached. It is a new model of healthcare. And that model depends that we have a local clinic facility through which we can create awareness, which can create primary prevention, early diagnosis and the treatment, and shorter travel time. And what are the components of this model which I'm proposing? And I can assure you that there is no such model in Pakistan which works in this way. There is just one model in India and not anywhere in Pakistan. We are more focused on decentralized model of psychiatric and epilepsy care at the district level. 2 essential parallels and complementary approaches, namely center of periphery, center से लोग periphery की तरफ जाएं, and second is periphery to center. सिंपल सी बात है कि वो मरीज़ जो 20,000 रुपये खर्च करके मुझे सिर्फ एक मरीज़ दिखाता है, अगर वही डॉक्टर 20,000 खर्च करके उस जगह पे चला जाए, he can see 60 patients, 50 patients. This is our concept. And for top-down, bottom-up project, you need the ground resources, support, and the specialist resources. Ladies and gentlemen, we need the ground resources, and you will be very surprised that in our model, in our setup, we have a wonderful building, and you can see कि खैरात का मतलब या चैरिटी का मतलब ये नहीं है कि इंसानों को इंसानों की तरह ट्रीट न किया जाए. They are given the respect, everything is channelized. And this is the gentleman, honestly, who gave his whole building to us for this purpose. And now we have completed about 6 years of service to that community. We also need the support resources. And honestly, you can see we have all these volunteers. We are not paying anybody. These are all volunteers who are supporting us in running our clinic. And when we talk about our resources, we have psychiatric services, we have pediatric neurology with 5 consultant pediatric neurologists, 3 adult neurologists, physical rehabilitation services with 2 consultants of specialists in rehabilitation medicine. We provide EEG, nerve conduction studies, and EMG studies free of cost. So we have the people, and Sir Nasser, this is for you. There is a young gentleman from Canada, Dr. Nasir, who joins us on every Sunday for the free online clinic. If you wish, we can add you. So if you see our pediatric neurology team, you can see a galaxy of people there. And everybody is a volunteer. No consultations, no charges. Adult neurology team, neurophysiology. And the process is, we have trained a medical officer and we have sensitized him in diagnosing the psychiatric and neurological disorders. He picks up the patients, gives them the computer number, the support team makes the arrangements, and the consultant at the day of the visit. So this is our background. You will be very surprised that why we chose Bhakkar. Again, in southern Punjab, this is a very low income and underprivileged area. We take about more or less 3 hours to go there. We leave about at 5 o'clock in the morning and return at about 10 p.m. in the night. This is just briefly about the area which we are serving. Now, nearest tertiary care hospital there, Nishtar Hospital, Multan, 180 kilometers. Allied Hospital, Faisalabad, 245 kilometers. Mayo Hospital and the Children's Hospital, 379 kilometers. So what these people should do. And closest access to the motorway is via Toba taxing about 100 kilometers away. So I would just, you don't take it as a statistical figures, but I just want to tell you what we are doing there. I joined there in March 2018. You can see the total number of the patients which I have seen. Gender-wise, you can see very interesting that male or female more or less, we are taking care of the both. And we are serving mostly the rural community, that is about 68% of the people. This may slightly appear weird. If Professor Raza Rahman would have been here, because he has conducted the nationwide study, he would have been in a better position. This is the patients who come to us. This is not the general population. These are the patients who report to our clinic. And this is our diagnosis, and these are our diagnostic categories. Now, another slide to surprise you is the follow-up rates. We have the CNIC, the telephone number of our patients. Before we visit, our staff gives them a call, and we have more or less achieved 100% follow-up. मरीज भी देखते हैं, दवाई भी मिलती है. Neurological cases. This is very heartbreaking that most children there, because of the poor gynecological services and obstetric services, most are CP children and epileptic children. And you can see from 283 to 891. We have 2 consultants in rehab medicine. We have 2 doctors in physiotherapy and 6 physiotherapy assistants. And you can just see the results which speak for themselves. What are the EEG nerve conduction and EMG studies, we offer them free of cost. I would like just to pause over here. From year, this is just 3 years audit. In 2023, label price means market में इस दवाई की कीमत क्या है? We purchased about 30,98,615 rupees medicines. Again, we have not purchased, there was not a single donation from any pharmaceutical company. These are all donations and our own resources and our own friends. The purchase price, because we just let the company know कि आप जिस परसेंटेज पे किसी फार्मेसी को दवाई प्रोवाइड करते हैं, आप हमें उस पे प्रोवाइड कर दें. We just tell our patients कि ये ज़कात और सदकात के पैसों से है, जो साहिब हैसियत हैं वो ख़रीद लें, जो नहीं ख़रीद सकते उनके लिए पूरे 1 माह की दवाई फ्री है. And we provide each and every medicine free of cost. Absolutely. You can see we have donated about 16,17,940 rupees. Now, when we talk about the model in practice and the model which I'm presenting, what are the strengths of this model, what we call the top-down, bottom-up project? Shorter diagnostic cycle. We are sitting there in the Bhakkar, the patient just drops in. And less financial burden on the patient. He has not to go to Lahore, Faisalabad, or Multan. And quicker response. But on the same time, there are a few weaknesses in this model. And these weaknesses are limited area of coverage means scalability is untested. And this does not account for remote areas with no infrastructure. So ladies and gentlemen, we are not doing only this. We have added this. Right from 2018, COVID or no COVID, we have in last 6 years, we have not missed a single, what you can say, a free medical camp. In those days, when the Punjab is in the grip of extreme fog, or in the COVID days, we were doing telepsychiatry or telemedicine camps. And I'm really very happy that the people in our village, they are very, very comfortable talking to you on the telephone, on Skype, on WhatsApp. Another thing which we have added is what to do about those people who need emergency medical care. My numbers are with my team. When a restless patient, an agitated patient drops in at our center, they just call me on the Skype. The doctor examines him, and we prescribe for the emergency period. So he has not to come spending 20,000, 25,000 coming to us. Excuse me. Again, we have not limited ourselves to this. We have carried out there 2 conferences of pediatric neurology and psychiatric disorders at the Bhakkar. And we have made sure that all the doctors, all the specialists in the Bhakkar, they were sensitized for our camp. Now we are very happy that even they select their patients and they refer their patients. Just 2-3 statistical concepts: diagnostic gaps, treatment gaps, and adherence gaps. Honestly, we have brought them to less than 10%. From 80% when we started the clinic, and now it is about 10-12%. ये चलानी है 1 मिनट, just 2 minutes. So sir, this is our reception. It is all computerized. We assign the number, we call them for the follow-up. Charity does not mean कि लोग बेतहाशा बैठे हों, फजूल बैठे हों या उनकी इज्जत नफ्स मजरूह की जाए. Our chambers are not like the shabby chambers. Our specialist in rehab medicine, another specialist rehab medicine, Brigadier Ahmed Wahid Butt, Professor Akbar Malik from Lahore, Nasir Sayyid, you must be knowing him, head of Children's Hospital. Neurologists, our EG team, again we are doing nerve conduction studies and EMGs, again free of cost. We have a full rehab setup. So this is our team, sir. Thanks you once again. And if there are any questions, you are most welcome to ask. Sir Muaddad, I really missed you. तो कल आप ज़मीन से जुड़ने की बात कर रहे थे, तो हम ज़मीन से जुड़ गए हैं और 6 साल से वो काम कर रहे हैं जिसकी तरफ कल आप इशारा कर रहे थे. जी सर.
So this is Dr. Fahadis from Services Hospital Lahore. First of all, I'd like to congratulate you for the wonderful work that you guys are doing. I just wanted to inquire about what sort of measures are you guys taking for when you have to advise investigations to the patient? Because of a lot of the diseases require neuroimaging or certain investigations. So how are the patients over there managing that?
In fact, we requested the Al-Khidmat labs. They provide us with just 25% charges. EEG, EMG, NCS we are doing. लेकिन अगर हमें बाकी स्टडीज चाहिए तो डिस्ट्रिक्ट हेडक्वार्टर हॉस्पिटल भक्खर इज़ वेरी काइंड, वो हमें सीटी स्कैन की फैसिलिटी प्रोवाइड कर रहे हैं. बाकी जो लैब फैसिलिटी है वो अल खिदमत वाले हमारे सेंटर की वजह से दे प्रोवाइड दीज फैसिलिटीज़ टू अस at 25%, and that is a great help to us.
So just to compliment the nice words other person has said about your this performance, taking in account the lecture or the talk given by Professor Mohammad Hussain Rana last night, that हम लोग ज़मीन से भी नहीं जुड़ रहे हैं, आसमान तक भी नहीं पहुंच रहे हैं, so we are in suspension. तो जब जो चीज़ को सस्पेंडेड रहेगी तो ना वो ऊपर वाले का फ़ायदा करेगी ना वो नीचे वाले का फ़ायदा करेगी, ठीक है ना. सो एटलीस्ट बाय लुकिंग एट आपने मिस किया, बड़ा अच्छा भक्कर में जो है वो उन्होंने वो काम कर रहे हैं और वहाँ पे जो है वो आप इतने ज़्यादा पेशेंट्स को देख रहे हैं और सारे स्पेशलिस्ट जा रहे हैं वहाँ पे. जो वो मज़े की बात ये है, एंड वो जस्ट इन्होंने कहा कि कोविड और नो कोविड इन्होंने ऑनलाइन एक सिस्टम वहाँ पे सेट कर दिया है एंड पीपल आर थ्रॉन्गिंग टू दैट प्लेस, विच इज़ रियली कमेंडेबल सर. एंड हमारी तरफ से जो आपको ढेरों दुआएं और आपकी तरक्की के लिए जो मज़ीद और मरीज़ों को अल्लाह ताला सेहत दे जो
बहुत
क्योंकि जरा तो दिखा रहे पता नहीं होता की बनता है
थैंक यू वेरी मच सर
It is all about doing, sir, and you are doing. We are just talking, but you are doing it.
थैंक यू
Cheers.